Before we begin, I would like to thank Councilmember Gibson and Councilmember Cohen for being here today and for their work on behalf of the Bronx community. And they will be saying a few words in opening. Councilmember Gibson represents the 16th Council District, serving the communities of Concourse, Concourse Village, Claremont Village, Highbridge, Mount Eden, and Morrisania. Welcome, Councilmember.
Good morning. Thank you so much. Thank you. Welcome, everyone. Would you like me to begin?
Sure.
Oh, okay. Thank you so much. Thank you to POTS, part of the solution. Thank you, Christina. Thank you to the entire staff, all of the volunteers, and everyone who has joined for this breakfast series, this forum to really talk about the future of the Bronx in a post-COVID world and what that looks like and the roles that we all play. I also want to thank my Northwest Bronx colleague, Councilmember Andy Cohen, and certainly all of my colleagues in the Bronx City Council delegation. This has been a challenging time for all of us here in the Bronx, here in New York City. Unfortunately, we've lost thousands of New Yorkers to the COVID-19 pandemic. Thousands of neighbors, families, and friends are on the road to recovery who have survived COVID-19. And I think this is really a reminder of a lot of the challenges that we have always faced in New York City and certainly in the Bronx. And I continue to pray for many of those affected by COVID-19. I myself was tested for a second time just last week because it's really important to continue to get tested, as well as making sure we have access to resources and programs. So I look forward to today's conversation with part of the solution. And I thank all of you for all of the work you've done during this pandemic, the services that you've provided, the distribution of food, of access for families and children has been very, very critical during this time. In the City Council, we have been a partner with POTS and many other community-based organizations. During the pandemic, when we saw long lines at food pantries and soup kitchens, we worked with the administration to expedite $25 million so that many of our food pantries and our soup kitchens could access these dollars, because we know that many of our organizations were serving more people like never before. We worked with the administration on the rollout of the PEBT program, Pandemic EBT, which allowed certain families that had school-age children extra money on their SNAP card so they could access more food and resources for their families. We've been a huge supporter of so many of our community partners like Hunger Free America. A few weeks ago, we joined Joel Berg and we opened up a new office on Sheridan at 164th Street in my council district, which is going to help families access SNAP benefits as well as other programs that are necessary. We're working with farmers markets throughout the city of New York and throughout the borough. We are funding the Health Bucks initiative in the City Council, which are the $2 coupons that you can use to access fruits and vegetables at our local farmers markets. So we have to do a lot more. We know that the times are very challenging, but I really look forward to working with all of you, both on a policy perspective as well as a budget. Andy Cohen and I struggled with this budget. We had a $9 billion deficit. We had to make very hard decisions that impacted many agencies across the board. And we are hopeful in this day and age that we can get either federal dollars or the ability to borrow from Albany so we can avoid layoffs of city workers, as well as we can put money back into many of our agencies that lost a significant amount during the budget. So I look forward to working with you. Thank you, POTS, for everything you're doing. Whatever we can do to help further your effort and your mission, please know that we are here to support you. My district of the Bronx, the West Bronx, and Claremont Village, Concourse Village, Highbridge, Mount Eden, Morris Heights, and Morrisania, we stand ready and willing to work with you because we do have a lot of work ahead. Food access is a challenge. We live in food deserts where we are not able to access food as easily as other communities. Healthier food should not be more expensive. We need better options and better choices. We need to expand on many of these programs, like the Fresh program for supermarkets, to access more programs. We need to work with all of our city agencies and partners in this effort. So I thank you for your time this morning, and I look forward to our conversation. And once again, thank you all for everything you're doing to keep families alive and safe and healthy so that we can continue to build a vibrant Bronx, a stronger Bronx, and a healthier Bronx. Thank you so much.
Thank you so much, Council Member. Now I'd like to introduce Council Member Cohen, who represents the 11th Council District, serving the communities of Bedford Park, Kingsbridge, Norwood, Riverdale, Van Cortlandt Village, Wakefield, and Woodlawn.
Thank you, Christina. Good morning, everybody. Good morning, Vanessa. Good to see you. I really just wanted to take the opportunity to say thank you to POTS. When I first ran for office, and it's still true today, is that what I said is that if I was going to have any success, it was going to be based on successful partnerships. And POTS has really been there for the people that I serve, long before I got into office, and hopefully long after I'm gone from the scene. But it's that partnership. When I first got into office, I didn't know who was delivering these kinds of services to my constituents. And POTS is technically not physically in my district. It's just a couple of blocks outside the district. But I know that my constituents use it, and the quality and level of service they get there is very, very impressive. And I've been a big supporter of POTS in my council capacity. I think based on a napkin calculation, I've secured over $140,000 for POTS in my time in office. In this budget, despite, as Councilwoman Gibson said, an incredibly difficult budget, I was able to get POTS almost $20,000 in food pantry money. And it just really is a testament to the good work and the important work that takes place in POTS. So for that, I'm really incredibly grateful. You have a great panel. I work closely with MPC also. It's from our perspective, from the city council perspective, trying to take a holistic approach, whether it's, providing services to our most needy or economic development. It's, obviously the city is one system, and trying to make sure that everything works and that we're trying to address all the needs is incredibly challenging. But really, again, I just wanted to thank POTS. My commitment, as I think perhaps my time in office is growing short, my commitment to POTS is going to transcend my time in office. My family volunteers at POTS. The last time I was there, I came to go visit my wife and daughter who were volunteering there. So that you can count on me going into the future. And I wish you all the greatest success. So thank you very, very much. I'm going to leave because I'm going to a food distribution over on Gun Hill Road. So thank you very, very much. Have a great day.
Thank you so much, Council Member. We really appreciate it. Thank you for your support.
My pleasure.
So I'm going to just share my screen now. Great. Well, thank you so much for joining us today, for the opportunity to discuss the impact the pandemic has had on vulnerable Bronx communities. I joined POTS in June 2012. This was nearly 4 years after the financial crisis in 2008, after the initial bank failures and housing market implosion that precipitated that crisis. At this point, many in the US and globally were still recovering. The Occupy Wall Street protests had happened the previous fall. The Bronx was also still experiencing many difficulties associated with the financial crisis, and it was recovering slower than other communities. Despite being home to 2 congressional districts with the lowest home ownership rates in the nation, 8% for NY13 and 9% for NY15, which is more than 56 percentage points below the national average, the financial crisis, set off by a housing crisis, impacted the Bronx more than it impacted neighboring communities. It was hurting from the banking crisis, even though there are fewer banks in the Bronx than there are in many other places. You could see this in the demand for POTS's services, the elevated unemployment rate, and the incredible demand for housing legal services. Despite this lag, the Bronx did start to recover. Jobs became easier to find, and many long-term unemployed were finding their way back to work. And businesses started flourishing. investing in their facades, marketing, and other things that had not been possible during the financial crisis. And by December 2019, the Bronx had a 4.4% unemployment rate, the lowest since measurement started. But despite the low unemployment rate, there were structural economic challenges that burdened the community, many that were connected to the racial makeup of the Bronx community. The homeownership rate is very low, and so as rental prices rose quickly, it became more and more expensive for most households. And 65% of our community was rent burdened. Many Bronxites work in the service sector or in other positions where workforce protections are limited. In 2019, people could more easily get jobs, but they could also be easily discarded by the companies that hired them, making savings very difficult. The health of the community continued to be the challenge, and the Bronx ranked 62nd out of 62 counties in New York State for its health. Things were looking better, but the green shoots were tender, and COVID and its impacts had set back the Bronx because of the precariousness of the recovery, and it has been set back severely. On this slide, I present some indicators of the economic impact of the crisis, the COVID pandemic crisis. We will surely know more over time, as many important measures will not be out and available for several months. But here are some that are available to us at this time that can give us a clearer picture for what's happening. The unemployment rate shot up and has been above 24%, starting in May through July, the last date available. This compares to the unemployment rate in Greece during their severe debt crisis a few years ago. The number of families on cash assistance in New York City has similarly gone up precipitously. The Household Pulse Survey, conducted by the US Census, was started in late April to track the impacts of the crisis on households. This was during the worst period of the pandemic in New York. And it shows that food insecurity in New York has worsened since New York opened up. The same numbers still fear losing their jobs and hours as they did in April. And business bankruptcies are up, with many analyses showing that Black, immigrant, and Hispanic-owned businesses are being impacted at a rate far greater than the average. We conducted interviews with 9 clients over the last week to get some more granular information about the impact of COVID-19 on their lives. One of the wonderful things about working at POTS is that we have the opportunity to hear directly from our client community about what's going on and what's needed. The clients that I interviewed worked before the crisis in restaurants, shipping and receiving departments, hair salons, construction sites, schools, and domestic settings, a very diverse range of employment and occupations. All lost hours during the crisis. Some were off for more than 4 months. Some are still waiting to get their jobs back. Some have completely lost their jobs and have yet to find one to replace them. Most are 1 to 2 months behind on rent. The focus of many has shifted from planning for goals, of, for example, finding an apartment appropriate to the size of their family, or starting a business, or taking a vacation with their family, to making sure that their families are educated, fed, and housed. In essence, they have gone from planning for a better future to surviving. I also asked clients about food and nutrition and found that by and large, the ramp up of food distribution and SNAP by public and private sources did keep people eating and eating relatively healthy food. Councilmember Gibson referenced the pandemic EBT program, which was extremely important in our community, where many received $420 extra of SNAP in order to buy groceries during this crisis. In addition, people were able to access food at food pantries and through food delivery and other programs through the crisis. 2 responded that they did cut back in some way, either on meat or on other higher quality products, but most did not respond in that way. So I feel like I happily can report that at least the immediate efforts of many, both public and private sources in our community helped people maintain their nutrition during this crisis. In addition, I saw that many of the government financial supports were a success. Those who received the extra unemployment benefits, along with the stimulus checks, reported that they were able to keep up with rent. That was not true of those who did not receive those checks. And many in our community did not because of either their immigration status or because of the nature of the job that they had prior to the pandemic. POTS can provide supports, and it has distributed extra food, access to direct cash support, and more bill pay than ever before, but it cannot match the needs met by government. In general, we saw that families that had this access were doing well. Ideally, POTS supports families in periods of transition before unemployment kicks in or in assistance with access to education or a job. Unfortunately, due to holes in the financial safety net, this is not generally the situation, and especially as relates to POTS's immigrant population, who does not have access to most of these government programs and are subsequently in crisis. Overall, the government supports have ensured that people could live with dignity at a very challenging time. But these supports that I reference are finished. And as the effects of the pandemic drags on, it is important that the public sector take steps to support our community in need. Before the crisis, POTS was turning families away who needed support with rent arrears. This was when the unemployment rate was 5% and the situation was improving. Even then, 65% were rent burdened, meaning that they paid more than 30% of their income on a monthly basis in rent, and 32% were severely rent burdened, paying more than 50% of their income in rent. This is the highest anywhere in New York City, and many clients who come to POTS, we routinely see 70, 80, 90% of their income being spent on rent. The loss of employment for 25% of the workforce can only be a disaster in this situation. There is little up-to-date public data available on the Bronx since the pandemic as relates to housing policy measures. But arrears are accumulating, especially with the end of the extra pandemic assistance, and there is a risk of great homelessness. Sociologists know the incredible lifelong impacts of homelessness on mortality rates and earning potential, and it is important that policy is put in place. The clients we spoke to who had housing vouchers, for example, Section 8, HASA, or FEPS, along with pandemic assistance, have managed to pay rent during this crisis. Those who didn't, even a client who was employed through the crisis, are behind by 1 to 2 months on rent, and they are seeking help. Many already live in difficult living situations with many more people in an apartment than intended, or in apartments that are in disrepair. So there isn't very many places for these clients to go should they not be able to pay the rent in the apartments that they currently live in. POTS staff have been seeing a lot from clients about this need for housing. Every single day, clients ask the food program and receptionist staff for help, and need is again exceeding capacity. Complicating matters right now is the complexity of the status of housing court and knowing who has future ability to pay rent given the amount of unemployment that's available. It is very difficult to help families if they don't have a plausible future ability to pay rent. Based on housing court schedules, evictions will be slow prior to 2021. Court is slated to reopen on October 1st, but it first has to address evictions filed but not completed pre-pandemic. Then those ready to be filed pre-pandemic, and all have to have housing court hearings prior to eviction. This will slow things down. Additionally, the CDC guidance will likely provide a break as well. But rent arrears continue to accumulate for many, and there is no solution to that problem so long as unemployment is high and wages are low. As has been reported widely, the Bronx and communities of color generally have been disproportionately impacted by the COVID-19 pandemic. As cases grow in communities around the country, the Bronx has managed to keep its rates very low through the summer, with record low rates in this past week. But it is still at 5th in the country in the number of deaths. The Bronx already struggled with health prior to the pandemic, ranking 62nd out of 62 in the county health ratings done by the Robert Wood Johnson Foundation. These rankings look at an extremely wide variety of factors, from the percentage of people who smoke to mortality rates to what people's housing situation looks like to the number of doctors available in any given community. And putting all of those factors together, the Bronx has been at that level for the past 8 years that the ranking has been done. Health and mental health has been impacted in our community. Many are experiencing anxieties. Many share homes with several generations or with someone who is more prone to become seriously ill with COVID. As we have seen families with deaths, with permanent health damage due to the disease, and I sincerely hope that our success in low case rates will continue until a vaccine is available, since we know that the Bronx faces grave dangers with any spike in disease. Our community has experienced this pandemic in its extremes, from the numbers who became sick to the numbers who have permanently or temporarily lost jobs and who risk losing their homes once the eviction moratorium is lifted. In order to help the Bronx come out the other side, serious work needs to be done to support this community. We all need to make a commitment to remember that those that still face severe challenge and help them do something about that challenge. Thank you so much for listening to this overview. I would now like to introduce our panel in the order that they will speak. Gregory Jost is the Policy and Organizing Advisor at Banana Kelly Community Improvement Foundation and an adjunct professor at Fordham University. He is a well-known expert on housing policy, particularly redlining and issues that have impacted housing policy in the Bronx. Daniela Beasley is a program manager for the Moshulu Preservation Corporation, which works to help small businesses thrive in the Bedford Park and Norwood neighborhoods in the Bronx, and it publishes the Norwood News, a weekly paper that focuses on local issues. Dr. Jane Bedell is a former senior official at the New York City Department of Health and Mental Hygiene in the Bronx, and she spent her career focused on issues related to public health and disease in the Bronx community. Thank you so much for joining us today. I am now going to turn it over to Greg.
Good morning, everyone. It's so good to be with you all this morning, day after Labor Day, getting our work week started again. And thank you to POTS for having me here and to our elected officials who joined us this morning. So I just want to respond a little bit. I won't take up too much time here, but I want to share a little bit about some of the work that's going on the ground right now and in response to everything that's happened. And you know, we've, you know, this is a bit of a bleak picture. And I think what's interesting too is, you know, like the Bronx has struggled in many ways for some time, but we've also know ourselves as very strong, creative, resilient people here. And I think it's good to look back over time and see in which ways have the people of the Bronx really taken it upon themselves to make a way forward, no matter what. And we can look back to the early decades in the 20th century around redlining and urban renewal, and into, as you know, as it continued into the 1970s, and the Bronx being home to one of the most powerful and innovative community organizing movements in the country. And I haven't even said anything about our cultural creativity, about the music that's come out of the Bronx, including in very difficult times. So I want to just keep that also at the center to remember that, you know, we are not just victims in all of this, but we have agency. Folks have been organizing for some time, and you know, fortunately, the rent laws that were passed last year are had created some level of protection. Obviously, that's pre-COVID, but that type of work and showing, you know, how active folks in the Bronx were in that campaign through a number of different coalitions that are citywide and statewide is really indicative of our potential as well. And so folks continue to organize. I want to just highlight some of the different ways that people, you know, the analysis that folks on the ground have, that organizers, that leaders, neighborhood tenant organizers and tenant leaders, as well as folks working on economic issues and a host of different ideas around, I think, what I like to call like models of collective ownership and control. And that's nothing new in the Bronx. People have been working around that since, you know, I think we can look at a lot of lessons from a few decades ago when things look extremely, extremely bleak, and people using, you know, people of faith, people like not giving up their faith to fight and really like overcome what look like unsurmountable odds, to rescue buildings, to do, you know, to save their neighborhoods. And so I think we can learn a lot of lessons there and think about how do we continue to build degrees of ownership and control. And for us at Banana Kelly, I'll say, and I know a lot of groups around the Bronx as well, and for a lot of residents who live in what we call community controlled housing, that is a huge benefit in this moment, to know that either if it's a limited equity cooperative, if it is a mutual housing association, if it is housing that is run by a neighborhood housing organization, a nonprofit, you know, you're in a better shape right now. And so we've also been able to organize with folks who live in that housing, specifically for myself at Banana Kelly, to look at some of the bigger picture issues as well. So I'm going to just briefly run through some different things that folks are working on both levels. So to deal with like immediate crisis, but then also think much more broadly and systemically about why are we more deeply impacted by a pandemic than other people in other communities? And I think that's a very important question to not lose sight of in the midst of this, while we still have to tackle like the day-to-day reality. So in terms of immediate relief right now, there's a package of 3 bills that are in the state legislature right now that have been introduced, and a lot of folks are organizing around this around the state, including here in the Bronx. One of them is the Emergency Housing Stability and Displacement Prevention Act. And that's sponsored by Senator Myrie and Assemblymember Reyes, and it would extend the universal eviction moratorium for 1 year to make sure that folks are not evicted during this time, right? I think, and so legislatively, that's the first kind of grounding basis. And then the second piece really looks at like, so what do we do about this back rent question? So I think, as you mentioned, especially folks who probably kept working at low wages and or folks who are undocumented and unable to collect any kind of support, or for whatever reason, you know, you get excluded, right? Not everything has been universal. So the second bill is the Rent and Mortgage Cancellation Act of 2020, and that's sponsored by Senator Salazar and Assemblymember New. And that calls for the cancellation of rent during the crisis plus 90 days, and it freezes all rent and gives every tenant in New York the right to renew their lease. And a really important part of that is a landlord hardship fund. So if we look at community controlled housing, to make sure that landlords who have to deal with the issue that their tenants can't pay the rent are also getting some relief, which is really important, because we know that the buildings still need to be kept up in good repair, that water bills need to get paid, that, you know, property taxes need to get paid. We don't want buildings spiraling out of, you know, being kept up well. So whatever kind of support, this bill also allows for that. And I think we can think about it also in contrast. You talked about home ownership rates. You know, if you're able to get a forbearance on your mortgage, you know, it adds it on to the end. So in a sense, even though it extends the term of your mortgage, you're not required to pay anything in this current moment. So it's hard to do that with rent. But this is a solution, and I think, I'll just add in that the last one as part of this package is the Housing Access Voucher Program, sponsored by Senator Kavanaugh and Assemblymember Simberwitz, which would create some much needed money to for housing vouchers for New Yorkers experiencing homelessness, which I think at this point is close to 100,000 people and could be more in New York State. And I think broadly, right, for us to think about and keep in mind why we are being impacted so deeply and so heavily in this moment. And our framing and understanding of history is important. As you mentioned, I do a lot of work on history of redlining and thinking about it, putting it in the context today. One way I like to talk about it is in framing around the economy as being an extractive economy. And I say this because I know that there's a lot of wealth in the Bronx, and often that wealth gets sucked out. So the reasons that we have the racial wealth gap isn't because, you know, and I think it's probably growing even more in this moment, but some data from maybe 5 or 6 years ago showed that the median wealth for white families in this country is about 17 times that is for Black families and 16 times that of Latino families. So for us to understand that that's not by accident, it's not because some people, you know, white people work harder and Black and Latino people don't work as hard. We know that living in the Bronx. We know that's not the reason. So we have to think about, well, where are the profits going? And if we can even consider in this moment who's profiting off of the pandemic, and look at the stock market, it's doing fairly well, which makes, you know, it's kind of mind-blowing in this moment to know that, given where all the other economic indicators are at. And we can see other signs of it. Just in the last month, we've heard about 2 different bank branch closures in the Bronx that are happening. Amalgamated Bank and Sterling Bank have both announced that they're closing bank branches. We have a proposed rule change by one of the federal bank regulators that would, as their solution to people being in such desperate times, allow predatory payday lending to come into New York State and basically get rid of our usury cap and say that, oh, if you're struggling, you know what would be great? We'll let you take out a 600% APR short-term loan. And it's going to be done by some, you know, convoluted method of letting online kind of financial tech companies partner with national banks and evade our state usury cap. That would be terrible. And we could think really like, well, how do we design policy responses that don't suck more wealth out? And this is a perfect example of that, because who would really profit off such a policy like that? To something that, how do we continue to turn the tide in terms of wealth control and ownership in the Bronx? And I think there's a lot of folks also organizing around, and people are organizing on those 2 issues. We've done a lot of work around the bank branch closures. I know some of my former colleagues here from UNHP have been working on that as well. University Neighborhood Housing Program, sorry, I'll try not to talk in acronyms. And then there's also a lot of work that's happening around broader collective ownership and community ownership in terms of housing, and also other financial systems. And I think that work is really important to highlight in this moment and think about, if we see buildings going into foreclosure, how do we rescue them from the cycle of speculation and put them into community control? Because we know that that is a place to provide stability for people in the Bronx, and also to make sure that, you know, well, I'll say that one thing is that many buildings that are most at risk for, where tenants are most at risk being pushed out, displaced, those are buildings that have been through many cycles of speculation, boom and bust periods, and it's not good for our people. And so there's a couple different bills out there at both the city and the state level around Community and Tenant Opportunity to Purchase Act. I'll say there's also, in the New York State Community Equity Agenda, we're working on bills such as a Public Banking Act that would have deposits, municipal deposits, be able to be held in a form of trust that can be invested in this type of work, with some accountability measures. And I think that type of work is really important in this moment. We think about, where do we want our funds to invest in for the long term? How do we build up more stability for our residents? How do we honor their agency and determination and hard work in a way that we keep them out of these precarious situations? And as you said, like, going through an eviction is even more destabilizing for a family that's already in difficult times. So all that type of work, I think, is really important. We've got 2 more panelists, so I'll stop talking, and happy to take questions later. Thank you.
Thank you so much, Greg. I really appreciate that. Now I'd like to bring Daniela Beasley of the Moshulu Preservation Corporation.
Hi. First of all, thank you so much for having me. We love that Potts is right in our district, in the direct area that we serve. For a little bit of background on Meshulah Preservation Corporation, we serve the communities in the Northwest Bronx that are near Montefiore health system locations. So while Montefiore is taking care of your physical health, we're more focused on the social determinants of health. And we do that through small business support, neighborhood development, quality housing, and local news. So specifically in Norwood, we run the Jerome Gun Hill Bid and the Northwest Merchant Association, which is where Potts is located, where we serve 204th Street, Webster Ave, and Bedford Park Boulevard. And just our area was hit so hard. I mean, the entire borough of the Bronx when COVID hit. To give some numbers, during the height of COVID, our businesses were reporting losing up to 90% of their customers, of their customer base and their business, if they were even allowed to stay open. You know, that's where those numbers are from, compared to 67% reduction of business in Manhattan. So it's just the disparity between those numbers is definitely evident of how hard the Bronx was hit. So the merchants in the Bronx, they were shut out of a lot of the grant and loan opportunities. One of the grant programs for New York City small businesses, it was reported that Bronx small businesses received less than 1% of that grant money. So many of our merchants didn't qualify for the funding that was put out specifically to try to help them because of either their citizenship status, the way they kept their books, too many employees, or the loans and grants that were set up didn't help them with the costs that they actually needed, which include rent assistance, supply orders, and things that would be bigger than payroll, because many of the programs that were set out to help all of our merchants was mainly focused on payroll. And to give an example of why that wasn't applicable to a lot of our businesses is, for example, hair salons, nail salons, barbershops, all of those people have 1099 employees. So when they were applying for this funding, they weren't able to qualify those people as employees because they were independent contractors. So SBA or, federal funding would come back and say, this is how much money you're allotted because of how many employees you have. And it would be nothing, because it would be barely anything, because they would only cover 2 months of the business owner's actual costs instead of all of the 5 employees or the 10 employees that they have in their stores. So, I think dedicated funding to our borough is definitely something that we're trying to advocate for, just because we were shut out of a lot of the opportunities, and having a wide array of eligible costs. So we also are seeing that in addition to rent, just supply costs are really bringing our merchants down. And we're seeing this because our organization has partnered with the 3rd Ave Business Improvement District for the Bronx Community Relief Effort. So that's a grant program that provides immediate assistance to small businesses with 20 employees or fewer to help assist with employee retention, fixed costs, and modification to business modeling to meet the new needs associated with COVID-19. So we're partnering with them to help with the verification process and also to get the word out to our merchants to apply to this program and hopefully get the help that they need. And through that application process, we're also using it as data collection. So we're seeing what these merchants actually are saying they need help with, and will help them stay open, or will help them reopen if they think that they can't even get to that point, which we're seeing. A lot of businesses, once they were shut down because of the policies, said, this is it, we're done. We can't come back because, even if we do reopen, the amount of back rent that we would have to pay in addition to the new rent, even though there's a moratorium currently on it, you're eventually going to have to pay that money. And landlords are already seeking that money, even though they can't evict them. The looming cost over your head of that amount of back rent is just having a lot of our small business owners reconsider if they can actually continue to stay open or if it's worth reopening. So, I think that in addition to all of the reopening phases were very confusing. The guidelines didn't read very easily. Getting merchants to fill out safety plans and having access to the money that they would need to make those changes in their business was very, very challenging. So that's kind of where we tried to step in, and we pivoted the way that we interact with our businesses, where normally we would be giving them general marketing help and one-on-one consultations and, compliance checks and things like that. And then suddenly we were just, scrounging for every funding source possible, right? And helping them apply for loans and grants. And with helping them apply, I think it was just, obviously working in this industry, you see how the Bronx is left out of a lot of things, but just, helping these merchants that, technically are eligible for these funds, right? And they're legitimate businesses that just need help and are trying to bring good economy to the communities that we work in, but then they're being shut out of all of these opportunities was just very unfortunate. And now we're kind of just trying to figure out our reopening, recovery, and emergency strategy for if this second wave that everybody's talking about does come, so that hopefully, what happened on the first wave of COVID doesn't happen if businesses are forced to kind of, shut down and transfer over to a more, websites and social media and things like that. Because a lot of the mom and pop shops in the Bronx don't before. I mean, now obviously they're adopting that model more because they're forced to, but before they were not very online business savvy type businesses. So yeah, I think it's just trying to help small business owners navigate that field and bring all of their, merchandising and the way that they think of their business model into the new normal, in addition to continue to advocate for dedicated funding for our borough. So.
Great. Thank you so much, Daniela, for that introduction. I would now like to move on to Dr. Jane Bedell, who can provide us some context around public health.
Great, thank you so much. I'm gonna work on sharing my screen. Let's make sure I can do that. Hang on, while I bring it up. There we go. All right, so Christina, is that sharing? Are we good? Okay, great. Thanks for inviting me. I come here really as a Bronx resident, as somebody who spent the last, spent most of my time as a healthcare worker and as a public health person, doing what the title suggests, trying to build a healthier Bronx. And I'm going to present some information and data, kind of big picture data, and then a couple of action items as well, although those are also kind of big picture items. And a lot of what I want to say, Greg and Daniela have brought the granular, important, very, very specific elements to. So keeping that all in mind. So just to remind ourselves who lives in our borough, who we are, this is just some broad brush characteristics. We are big. We have a big population here. We are bigger than many cities. We're bigger than several states. And bigness is both an asset and a difficulty. We are a huge majority Black and Latino, and that's been shifting over the last couple of decades. We skew towards young, 25% under 17. This age group of young adults are probably people seeking other opportunities and education elsewhere, and then people either come back or new people come in to settle, and you see that in the rest of the demographics here. We are an international county or borough, 90+ languages spoken in the borough, and about a third of us were born in another country and chose to come here to make our lives. So this is just a snapshot. There's so many different ways of presenting this data and different aspects of it, but this is just a little picture of who we are. Kind of picking up on what Greg said, we've got to think about what assets we have. We have some physical characteristics. We actually, very different from Manhattan. We have a lot of parkland. We have a lot of physical attributes that could make this a very healthful borough. I chose public libraries because those are an enduring institution that have gone through so many cycles of crushing disinvestment and then reinvestment. So that's emblematic of what neighborhoods can have, and still the public libraries endure. I'll present more data on this, but in the Bronx we have, over 170,000 people who were deemed, quote unquote, all of a sudden essential. I'm not sure they felt so essential before, but they became essential in the eyes of the city and the state and the country. And then again, just the magnitude of where we are. We have over 230,000 students who are enrolled in public schools, and I know school is starting in the form that it's starting in. 230,000, that's bigger than a lot of cities. That's just the number of students in the Bronx in public school. So again, the size of it, both an asset and a challenge. So Christina asked me to talk about sort of what do you look at when you try to measure health? And I want to underline that there are many, many, many ways to measure the health of whole neighborhoods or of a borough. But one that I think people can really understand is, how long am I going to live? What's the average life expectancy in this neighborhood for me, or in this borough for me? And so this is a map. The darker the color, the lower the life expectancy. And so if you're a kid that's born over here on the Upper East Side, you have a markedly different life expectancy than the same kid. This is not genetics. This is by design, different neighborhoods. It can be 5 to 8 years difference in life expectancy, the difference in neighborhoods, couple of miles. So we are marked by tremendous differences in these big broad brush health outcomes like life expectancy. And as several people have mentioned, the county health rankings, you can just Google that. Every year does this and measures the counties in each state, and in New York State, since they started this measurement, and no matter how they refine it and tweak it, we end up with the same result, which is by county, the Bronx is by far the county with the poorest health outcomes. And again, this is by design. So the policies and practices of yesterday are the things that determine the health outcomes of today. And this is really the theme of public health in a way, because we've got to change this in order to change the future. People have mentioned redlining, racism, housing segregation. Christina mentioned, and others, the lack of investment in the retail food environment. There's differences in access to quality medical care because there are different insurance systems and they reimburse at a different level. And so we have created by design a multi-tiered medical system. And education is one of the most important indicators for health outcomes, including life expectancy. And if you look at our education outcomes, there are also just tremendous disparities in high school graduation rates in the same neighborhood by school and in the city by borough. So there are still some high schools and neighborhoods that where it's hard to say that they're providing an education because almost half of the students don't graduate from high school. So I'm not quite sure. I kind of call those dropout factories. They're not really schools the way that we normally think of schools. So these are all important places where policies are implemented and continue and have a tremendous effect on the health outcomes of people. So let's look a little bit, trying to advance my slide, there we go, around COVID, because COVID, I heard one person say this, it's an interesting metaphor. COVID for the Bronx was like the cell phone video that we've been seeing in other places. This has been happening. This was no surprise to people in public health, but all of a sudden the video cameras are on and people are shocked and surprised that these inequities exist. For those of us who've been doing this work, and probably most of the people in this meeting, it's not really a shock, but it was a shock to other people, so we could utilize that as an opportunity, because I do think opportunities have come in this moment. So just to go through some of these, this is the redlining map of the city from the 1930s, preventing specific areas from allowing home ownership and therefore wealth. And this is the map of segregation. And we have, by almost any measure, we are always in the top 10 most segregated cities in the country. So people like to talk about New York as a diverse city. Yeah, kind of, sort of, not in terms of how we live. And we have tremendous disparity in terms of overcrowding and in our households. So the black dots are NYCHA developments, because the health department was looking at this. So kind of ignore the black dots for a moment and just look at the colors here. Darker area, more overcrowding. And you see the Bronx here, really, really different than Manhattan, where there's huge parts of very densely populated Manhattan where they just don't have the same level of overcrowding. And this was exposed since being in a crowded household is a risk factor for COVID transmission. Multi-generational households, you know, are what they are. Honestly, I feel kind of bad for these folks in Manhattan here who apparently don't relate to people a generation above or below them, because they're just a vacuum here for multi-generational households. So this is neither a good thing nor a bad thing particularly. We can all have our judgments, but in terms of COVID, it presents a severe challenge, as we all know. So mapping this out, again, gives us a little clue into housing policies and how they directly affect health. And then essential workers, as we've mentioned, the Bronx performs completely differently than Manhattan, except for maybe this upper part of Manhattan, which, you know, I live right over here, so I kind of consider that part of the Bronx, because demographically it's very similar. So we have a much higher percentage of quote unquote essential workers. And then fundamentally, as soon as we learned that COVID, this new virus, had worse outcomes in people who already had some sort of underlying chronic illness, you know, and this was back in January, those of us who do this work in the Bronx and work on health equity knew that the Bronx was going to be hardest hit because we have the highest proportion of many chronic illnesses. And again, this is not genetics. This is the design of our neighborhoods that makes us different. So how does this all add up? These are the same maps, except now we're looking at COVID cases over here on your left. Very high proportions, you know, again, Manhattan looking completely different, and then COVID deaths, which fortunately are at a lower rate, but still the borough as a whole performs really differently than Manhattan, just as a counterpoint. So all of those things that I mentioned and many more things adding up to a pretty huge health disparity in the outcomes for COVID. So to change the neighborhood health tomorrow, we have to change the policies and practices today, because if we don't learn from history, we are definitely going to repeat it. So we all know the ways to prevent it. I think New Yorkers have been kind of amazing. People in the Bronx have been amazing that we've gotten this far with our numbers this low. Our curve went up. It came down dramatically, and we've been percolating at this low level now for several months. So these are the elementary things. Vaccine is coming. Cross our fingers that we can trust that it's going to be both safe and effective. And when it is those things, then we're going to have to roll it out in a thoughtful, meaningful way. So part of the immediate public health challenge is to get ready for this. And then, you know, what I want to end on is the underlying thing here is to have really smart people like Daniela and Greg that have understood what these policies are, and elected officials that understand what equity is so that we can hold them to the task of creating the right policies. The Bronx has a longstanding history of being a low voter turnout borough, so we want to change that. And a judge just gave us all a little reprieve in the census and said it can't be terminated early. So getting the census count is huge because that determines federal funding for the borough. So I want to leave on these two civic engagement action items, but also recognize that there's a lot of civic engagement that I think people are participating in now because of COVID. They're helping out with food distribution drives. They're out in the parks trying to make them nice because we're all hanging out there. They're making sure there are garbage cans around so that the trash doesn't accumulate. They're checking in on their neighbors. These are all also forms of civic engagement, and many of these, when they're studied, absolutely relate to improved health for a neighborhood or a borough. So civic engagement is not limited to voting and the census, but voting and the census are really important right now. So it'd be great if everybody also participated in that. So I'll stop here, and I'm hoping that we can get to some great questions.
Thank you so much. I really appreciate that presentation. I'm just going to ask one question of our three panelists before we bring it to the general public. And there are a lot of people on this call who are interested in getting involved in policy and advocacy and civic engagement. And what would be the steps that you as panelists would recommend for people who are listening today to get involved in these types of issues?
So I think, like I said, there's a lot of organizing work already happening. You connect with any of that type of, there's some different coalitions. If you're interested in like the legislative battles, there's actions happening all the time. There's call your state elected officials, see if the person in your district is a co-sponsor. If you have an interest in getting connected in that sense, I'd be happy to share more information. But you probably know about some of the groups that are doing organizing in your neighborhood, so I can so look them up and just talk to them and see what are ways that you can support.
Daniela, you want to take it next?
Oh yeah, sorry, I saw you unmute yourself. I didn't want to. Yeah, I mean, I think even on the ground level, just joining some of the groups that are doing cleanups in the borough, right? Just because everybody's been outside and the littering has gotten absolutely insane in the Bronx, as I'm sure all of you know. So I know a lot of merchant associations and business improvement districts across the Bronx are holding cleanup days. So you can get out in your community and do that. Just trying to shop local. Keep your dollars in the Bronx, keep the wealth in the Bronx instead of using, Amazon or, big corporations like that. A lot of the businesses in your neighborhood have probably pivoted and offer either, deliveries or online ordering and things like that. So look into the ways that you can support your local businesses, because I guarantee you there are options that you didn't know were there before.
Yeah, totally agree with all of the above. Everybody knows that this mayor is term limited out. So in a year from now, there's going to be a hotly contested race for mayor. I think to the extent that organizations like POTS and other organizations can hold each of the candidates' feet to the fire about how they're going to transform the city. After the 2008 financial wreckage, what got changed in the city was, the wealthy figured out how to extract more wealth, I would say, in a big picture. I don't know if Danielle and Greg want to agree or disagree with that, but, that was the lesson there. Wow, they learned how to do that. And even if there were some things that improved in the Bronx, it was really vastly different than what had happened in terms of wealth being taken out. So we have a chance with COVID firmly in our minds to ask elected officials, both at the mayoral level, but I know in my neighborhood here, term limits are very active, and there's a crop of young folks who are looking to hold office, and I think that we're in a place where they can be influenced by community action. So that's on all of us to figure out if that's a mechanism by which, you know, you want to get involved in somebody's campaign on the ground at the city council level. We learned from the budget around COVID how incredibly important our elected officials have been, both at the state and the city level. And you don't always think that all of these things end up in health, but I'll just say almost every single policy has a health impact. And I think we agree as a society that it's the right thing to try to optimize everybody's health. I'm not sure we have consensus about many things, but I think that we have that, particularly children's health. So we're not so, selfish or however you want to say it, that we have disregard for that. There is still a common value. For a brief moment in time, basically our hospitals were ordered to be socialized by the mayor and the governor, right? All of a sudden, everyone in the city knew how full the emergency rooms were, and they were able to redistribute patients, ventilators, ICU rooms. Wow, that was an amazing thing. Maybe we want to put a system like that in place more permanently so that dialysis machines are equitably distributed. Access to subspecialty care is equitably distributed, because for a brief moment of time, we were ordered to do that under the duress of an emergency. But what it made me think is, that seems like a pretty good system. I'd like it if the care for somebody, in Park Slope, Brooklyn, was the same as the care for somebody in Mott Haven. So that's a challenge to us to kind of push elected officials for some vision of the city.
Thank you so much for sharing those. I would like to now open this up to the community watching the event to please put questions in the chat. I'll respond to them in the order that I see them. Let's see. Okay, so I have from Samantha Verone. It says, I've been working as a Census 2020 enumerator across the Bronx and have encountered a lot of suspicion, distrust of government, understandable, lack of awareness about importance of the census, and lack of interest in learning about it. I'm very worried about the breakdown of civic engagement and what it will mean for the Bronx in the next decade. As I said, this has been the case all across neighborhoods and demographics here. People don't want to be counted. I'm not sure what can be done now, as the count will end either at the end of September or October. But maybe pastors can make announcements in churches. Whatever engagements we are having, sorry, I'm trying to scroll. Are having with Bronx residents, if we have their ear, letting them know that getting counted matters. That's a great point, Samantha, the importance of the census. I don't know if anybody else wanted to add anything to that.
Yeah, I'm wondering what strategies people think are working in terms of the census. We're at, the last I heard from the census people was something like 50-something% response. And, that's every person's response on the census means, like, I've forgotten the number exactly, but it's over $10,000 per person in federal funding to the borough. So it's going to put us so far behind in terms of our rightful amount of people's tax dollars that should come back to the Bronx. So I don't know what's been successful. I'm interested in hearing about that and what plans people have in terms of trying to encourage the census count.
I think is a really important point that you brought up, Samantha, because we're constantly dealing with the issue that there is a lack of trust And I think that's, even if what Dr. Bedell shared before about in terms of the vaccine, you can imagine if there is a vaccine, we're all wondering can we trust? Will it be safe? But let's say it isn't, but there's so many people who are feeling like they can't trust the government in this moment. This is why doing that kind of very important groundwork over time is so critical. I think I was reading in like really shortly after World War II, there was a smallpox outbreak, and just if you look at the numbers of people who were vaccinated in such a short amount of time, I think they vaccinated like 5 million people in a month. It was like and that has to do with trust and also social fabric, strong connections, right? How do people, like you're saying, like what about the pastors making announcement in churches? There probably is a lot of that already happening, but that's also organizing work. And but Dr. Bedell and I were working on this a couple of years ago. Also, was like, how do we restore some of that trust? And I think the Department of Health did a really excellent job in bringing folks together to talk about like some of the historic reasons why there is such a distrust of government in a place like the Bronx. And there's other steps. Another campaign I didn't mention has just been around the rezonings, and I think that's another case where like the official line from city government is like, oh, we want to build more affordable housing. We want to build more affordable housing. Well, okay, true, but what about the displacement pressures that come from a rezoning? Because a lot of people will be displaced, and that builds more and more distrust. And so there is actually a bill introduced to require that in each kind of larger rezoning proposal that there would be a racial impact study done along with it. And I think those types of, like, they might seem like a small piece of legislation here or there, but it's like those are all sort of steps. How does planning happen? Who's at the table? Like, how do we do the decision making? This is the type of work that actually needs to be invested in. And I think with the census going out and hiring folks from the neighborhood who know people, who can go out and talk to people, that's the type of investment that we can see as a model, that we're hiring folks from the Bronx to do that type of work. Anyways, just a few thoughts. It's not an easy question. That's by any stretch of the imagination, but it's really important to bring up.
Yeah, I definitely agree with that. I think it's hard because when they hired people from these neighborhoods to kind of, do the census work, we all had a plan in our heads. I know a lot of them had reached out to our organization and partnering with businesses and going to barbershops and hair salons and places that people would have been pre-COVID. But I think, now that people aren't out, you can't just go out on the street and stop people, which is, where you would get a lot of people's ear and, be able to give them those facts and kind of persuade them to fill out the census, because of all of the information that you both shared here is definitely difficult. So, but it's very important.
I mean, one thing I'll share, just as a private citizen, there were more things happening in June and July, but being at these local demonstrations and seeing people gather together in different neighborhoods, it struck me. I don't really know the history of different neighborhoods, but maybe like the first time there's been like a social justice march in given neighborhood for decades, and a sign of hope to me is the way that I saw young people, giving voice to their concerns and also helping take care of everybody. It was done very safely. There was a lot of trepidation, of course, from the public health community about gatherings, but what I saw at least was people really looking out for each other. As an older person, I kept off to the side. People really respected that. And people were able to put their feet on the ground during that time period. Whether that's going to translate into more, civic engagement or more neighborhood action and neighborhood caring, we'll have to see. But there has been, I think, and that's part of what's kept us at low infection rates. I think people are, by and large, looking out for each other. So what can we do in our organizations, in our families, in our neighborhoods to kind of keep that spirit going? Because that's been a bright spot, at least the way I've seen it.
And one of the things that we see at POTS is the importance of listening to our community members as relates to what's going on in their lives and not just being prescriptive. And so trying to make sure that anything that we do is based off of listening, and that can help build trust. The other thing I'm going to note that this conversation reminds me of is, around 2000, after there had been several major serious problems, say in Rwanda and in other places around the world, there was a lot of discussion of how the absence of trust was a real major problem for civil society. And obviously those are extreme situations, but it is important for us to think about building trust. It's not just around the sense, it's around everything. Building trust with each other, building connections with one another. And in policy is an important way of making sure that we have a strong community and a strong democracy. And I think it's something that we do need to think about and put to the forefront. We have
Can I just say really quick that
Yep.
As a way to frame it, and how I like to talk to my students about it, is really to frame things in terms of infrastructure and think about the type of infrastructure that requires investment, and to think broadly about one of the texts we use by Dr. Mindy Thompson-Fulleylove talks really about when she's writing about what urban renewal wiped out was this infrastructure that really had jazz music thrive in America. And you could try to break down and sort out what are all the pieces, you don't usually think about a music form requiring infrastructure, but it does. And it required music programs in schools, instruments that kids had access to, mentoring relationships, infrastructure of more traditional trains and such. So I think in this moment, if we're thinking about trying to build trust as a high priority, we can look at our own existing organizations, like a place like POTS is a huge piece of infrastructure in the neighborhood. And there's kind of the obvious pieces that we talk about a lot in terms of making sure people have food, but and access to social services and legal counsel and such. But what you're talking about here is POTS is also really important infrastructure for people, for listening to happen, and for people to get to know each other and build trust. And I think all the different kind of nonprofits represented here, we play some kind of role in that, and to really talk about that more and highlight that in a way that we could attract more investment into that kind of piece of our work. And some creativity around it as well would be really important, especially in a moment like this.
I'm glad you mentioned music and the arts. So one of the things that happened one day, I get a text from somebody in my neighborhood. I'm here. It was not terribly cold, but it was sunny out and everything. It's like, there's musicians in the park. I'm like, what? And I go out there safely, and everybody's safe, and they're all safe. And some guys who were in a group together, turns out one lives on my block, never knew him before, and they just were yearning to play music together. And they set up outside, and thankfully the police and the Parks Department did not bother them, and they put on a concert in the park down the block. So there's so many creative ways. I feel like the Bronx and the residents of the Bronx there are all kinds of resilience, and it's in policy and voting and census, and it's also in a sense of we're going to come together in some ways that also bring us joy. So I'm glad you mentioned music as an example, because that's a nice tagging together of how infrastructure supports something, and also people can just get out and do it. Just do it. Do it safely, but there are different ways, and we're going to see how that works in the coming months. What we have all in us and what our organizations have in them, and then what to demand further as a neighborhood, as a borough, as a city.
Yeah, and as you mentioned before, just considering mental health in all of this as well, because this is, I think, especially as we get into the fall, cooler weather and less ability, this is going to be a big issue for everywhere, but I think here especially.
Thank you. I have one other question. How can we support the survival of the Bronx with the loss of jobs from the restaurant, tourism, and hospitality sectors, and those sectors that support them?
I would just go back to keeping your dollars in the Bronx and keeping them local. the restaurants and other businesses that are trying to retain their employees can't do so if they're not making any income. So, supporting your local businesses in addition to donating to some of the funds that are being set up for small businesses. So like I said, the Bronx community relief effort, there are no restrictions on what you can use that money for. And a lot of the small business owners, once they do get money, their employees are family, these are all small mom and pop shops. So they want to retain their employees. They want to hire them back. And then also I know GoFundMe started this program where if a small business starts a fund for their business as a business page, they'll match their $500 as a donation from GoFundMe. So, just looking up some of your local stores on GoFundMe, or, seeing how maybe you could, if you're, super engaged in your community, or you are on a tenant association or something, that you can partner with some of these businesses to see if you could, do, obviously a safe event with them, and just make sure that they're getting their names out there and their products and everything else. I would say is definitely how you can support, economics of the Bronx.
Thank you. I have another question. What would you like the Bronx to be like 5 to 10 years from now?
And I just jump back to that last question too, because I want to build off what Daniela was saying, but that's a really good question. Think about that. And that's a good question for anybody and everybody here. Like to hear from other folks as well. But I want to say, just in terms of businesses and thinking about even before COVID, right? Like what happens to businesses that one of the coalitions that we're in is trying to do is working on some bills that would help promote at least starting with like a center that would educate and ideally create some funding and for worker-owned businesses. And knowing that so many small businesses are owned by baby boomers who are getting close to retirement. I'm thinking about my mechanic who last year retired, and this is, is a Black mechanic. He's got great staff. It was really like, and this is in Bedford Park, and it was like, this was a great little business. And then one day it was closed. And what happened? I went in and I talked to the folks there, and like another place had come in already and took over the space, and it's like, oh, he retired and it was gone. I was like, oh, well, the idea of like a worker owner center, and this is what they call the silver tsunami, is one of the terms that they've used around it, is to say that as an option to really promote the idea that business owners could sell or hand over their business to their employees as they retire, and kind of broaden the to keep some of those really strong businesses alive and especially times like these, but at any given time. So that's actually a bill sponsored by our Bronx State Senator Jamal Bailey to help provide for a worker owner center in the Bronx. So and obviously I agree 100% with what Daniela was saying about as much as we can shop locally, do so. But we also know it's real challenging right now when it feels much safer to buy things online. But I did want to add that into the mix a little bit as well.
Great, thank you, Greg. I'm just going to back up to the Bronx 5 to 10 years from now and see if anybody has any thoughts on that. It's a hard question.
I'll jump in a little bit. I think there are some models out there that promote equity. So, you don't know what's going to happen. Is this a super cataclysmic time where we get to reshape things in the future? It has the feeling of that, but I also know that that means that people who want to profit from this are scheming to do the same, make this a big change moment for them. So I'm hoping that we can, as a city, and I think some of these things have to be city and state policies, kind of leaving the federal side out for a minute, to try to socialize more of our fundamental structures that promote health. So that would be access to medical care, that would be a better economic system that's going to equalize wealth more in this city that has just these tremendous wealth differences, and make home ownership and other wealth building opportunities there, because otherwise we're not going to change our relative position as the 62nd county in New York State. Everything may shift in a better direction, but the relative differences really have not diminished ever since they started doing these metrics. So we've got to put some things in place that are going to equalize things. So I'm hoping that people can have equity more as a value that they demand in their organizations, in their neighborhoods, in their city agencies, et cetera, and then these policy granular things will come out of that. That's really what did happen in the New York State representation in the last election, and there have been some pretty great policies that have come out of the New York State legislature. I mean, honestly, opening up access to voting and other, enfranchisement, and the whole way that we've handled rent and evictions up to this point, and I realize that we're at a precipice here, but that's really a reflection of the people that we elected previously. So we got to keep the pressure on.
Yeah, I definitely think looking into the future, all of the policy changes that can impact just the social determinants of health as well, right? So that, people in the Bronx have access and are experiencing just the basic necessities to be healthy as an overall individual, to have financial health, if you will, have good sanitation in their neighborhoods, and, access to healthy foods. And I think all of those definitely come from policy changes. But I also hope that the Bronx just gets recognized for all of the amazing, cultural things that we have to offer, while at the same time just making sure that we're improving our neighborhoods for the people that already live here. We're not trying to improve our neighborhoods so that other people can then come and be like, oh, it's great now, so I want to come live here. No, it's just making sure that the people that live here are being given the basic things to have an overall healthy life and to continue living here and continue their families and home ownership, passing on their homes to their families, and just making sure that the people of the Bronx are taken care of, I think, is just what I hope for in the future.
Yeah, that's really beautiful. I'm all on board. I think I'll just add, the ways that we can invest in our young people, of course. Listening to, I think the more we can do in terms of listening to young people, engaging with them around our history as a borough, as a people, designing a better future together. I think there's so much potential. I think we work with our big institutions as well that have a lot of wealth, make sure that wealth is staying here. There's some different groups working on that. Those types of models, like there's a Bronx exchange platform, and there's pieces out there. And I think what we really need from a budget side too is to make sure that the investment is coming into that kind of infrastructure, because the ideas are out there. People are working on it. There's plenty to latch onto and build off of, and doing that listening and directing some of that investment. I mean, I think that's also that's the Bronx success story as well, was they were attracting investment into projects that people were like, we already want to do this, you know, like people organizing and taking over their buildings. That's nothing new, right? Like that's been going on. I know there's folks on this Zoom that did that work as organizers for, you know, decades and decades ago. So similarly, it's like this work just requires investment. We have to, you know, we're basically dealing with a huge gap in wealth and control, really. And so I think as much as we can have more of those things here and invest in that type of work is what will build that brighter future for the Bronx.
Thank you all for your input in this presentation. It was really an amazing conversation. So thank you so much for everything today. I really appreciate all of our participants, and I thank Councilmember Gibson and Cohen for coming to speak earlier on in the presentation. And I hope you have a wonderful afternoon. Thank you so much.
Thank you.
Thank you for having us. Thanks, everyone.
Thank you for all you do, and thank you for having me a part.
Thank you all.
Terry Ham. God bless.
Thank you so much.